Hello, my name is Dr. Frank Jones, and I'm president of the Atlanta Medical Association. We would like to tell you a little bit about who we are, what we do, and why we think you would love to be a part of this organization. Founded in 1890, the Atlanta Medical Association is proud of our heritage and excited for the future. We continue to be the leading voice for Black doctors in Atlanta, in Georgia, and in the country at large. Our mission is to make healthcare universally accessible and attainable for all. We inspire and empower underrepresented minority communities to achieve health equity through our programs. In recognition of the success of our efforts, the Atlanta Medical Association was awarded the prestigious Large Society Chapter of the Year Award from the National Medical Association, our parent organization. As members of the Atlanta Medical Association, also known as ATL-MED, we focus on 6 pillars of participation: clinical care of our patients, educating the community, advocating for our patients, giving back to the community, mentoring the next generation of Black physicians, and networking and social opportunities for our members and friends.
Hello, I am Dr. David Blake, a family medicine physician practicing here in the Atlanta metropolitan area. I initially became involved with the Atlanta Medical Association during my residency training days. This gave me an opportunity to see firsthand what the practicing physicians actually do. There was a time when you would come to a city and you would have to join the local medical association to make contacts, to be able to develop your patient base. So when I finished residency, this gave me the same opportunity entering into my private practice to work with those who had trained me, to learn even more about the business of medicine, which is what we do with the Atlanta Medical Association. We help to educate one another, making sure that we can be not only good practicing physicians, but also profitable in our business so that we stay viable and here for our patients. We put together a video series, Ask a Black Doctor, where our patients can ask doctors questions about disease processes that they have or have heard about that affect the African American community at a higher rate and to a more severe degree. We even did an elderly video where our geriatric population had an opportunity to ask questions specifically related to COVID-19 when the pandemic hit. Should they stay in their homes? Should they get vaccines, flu shots, pneumonia vaccines? Should they take the COVID vaccine when it comes out? Can they get out and go to their favorite restaurant and have a meal? Should they interact with their grandchildren and their children? These are questions that may sound simple, but our elderly population, they need to know. They want to make certain that they protect themselves in these trying times that we currently are in. I had an opportunity to grow through the Atlanta Medical Association, ultimately becoming the president and serving as chair of the association, and currently sit as the vice president of the Heritage Fund, the philanthropic arm of the Atlanta Medical Association. So won't you please join the Atlanta Medical Association?
One of our most important pillars of participation is mentoring, and this is near and dear to my heart. To me, I'm more passionate about mentoring than almost anything else because it took me a long time to get to medical school. And I said that if I ever became a physician, I would do everything I could to help mentor the next generation of Black physicians. And so we spend a lot of our time, a lot of our focus on mentoring. You know, the best way to eliminate health disparities is to create more Black and brown doctors. And so we have a lot of programming centered around mentoring underrepresented minority physicians. Our committee chairperson, Dr. Nanetta Brown, takes mentoring very seriously as well. And so let's hear from her.
I'm Dr. Nanetta Brown, and I practice in Atlanta and Newnan, Georgia. I'm an ophthalmologist for the Thomas Eye Group. I joined the Atlanta Medical Association so that I could build a community. I wanted to know other doctors that I could send patients to, that would see my patients, and honestly for the social aspects of the community. I've been involved in multiple mentoring programs. I have students from Spelman and Morehouse shadow me in my clinics and in surgery. But the best event that I've been to this year is the Why We Can't Wait. The importance of encouraging Black men to go into medicine was so crucial. We had all kinds of students from Morehouse, we had medical students, and they were all able to meet with us and talk about the future of Black men in medicine. Thank you.